Comfort has arrived in Puerto Rico. The Navy's hospital ship, the USS Comfort, docked near San Juan Tuesday to help the island territory still struggling from Hurricane Maria. Tonight, senior correspondent Mike Tobin shows us what the ship and its crew are capable of doing during Puerto Rico's time of need.
Yes.
As the humanitarian crisis in Puerto Rico threatens to become a health crisis, the weapon to combat that is this converted oil tanker, USNS Comfort hospital ship.
We bring a level 2 hospital anywhere we can put the ship. So it's a unique component that you don't have most places.
The ship has 2 emergency rooms, operating rooms, x-ray, CAT scans. If needed, the 800 staff members on board can do anything from delivering babies to removing cataracts. About the only difference between this and your local hospital is that the beds are tied down and you cannot run an MRI machine surrounded by metal and navigation equipment. The need for trauma care existed in the days immediately following the hurricane. Doctors on the ship now expect the problems they encounter to come from elderly or weak, living in the heat, off their medication schedules, or away from dialysis, poor diet, and the overall impact of unsanitary conditions.
Diarrheal disease can be a problem. Down here in Puerto Rico, dengue is a mosquito-borne disease, and other mosquito-borne diseases can go up as well.
The ship can reach any part of the Puerto Rican coast in under 8 hours, and they don't need a port. A flight deck on top already carries 2 helicopters. What look like lifeboats on the rail are floating ambulances called patient tenders. Initially intended for combat support, the staff trying to prevent a health crisis in Puerto Rico can treat upwards of 200 patients a day.
Oh, it's very rewarding to be able to come here and do this. I mean, this is people in need, and this is really what we're all here for.
Captain Kevin Robinson says it was 7 days from the time he got his orders, got his ship staff, and arrived here in Puerto Rico. They are still waiting on directives for where specifically the need is the greatest and where along this island this big floating hospital should drop anchor. Brett, back to you.
Mike Tobin live in San Juan. Mike, thanks.